Hello, Dr. Sumeet Bahl. How are you?
I'm good. How are you?
I'm good. I'm good. First of all, thank you so much for spending this beautiful Brooklyn day with me on Zoom. I definitely greatly appreciate you, and I appreciate what you do as well for loving people. I want to thank you for your work, your service, your sacrifice, your drive, because you have to be driven to do what you do, and your love for people. So thank you for being a frontliner and pretty much saving us here in Brooklyn.
Thank you for having me. It's a pleasure to be here.
Absolutely. If people don't know, Dr. Sumeet Bahl is a interventional radiologist at Brooklyn Hospital Center. He's a plant-based physician. More than 99% of my audience will understand why you're here now, emphasizing in lifestyle change through diet and exercise. And you have more than 20 years of meditation experience. I've never thought I'd ever introduce a doctor that says, doctor, plant-based, and meditation all in one sentence. That's that's odd. But first of all, before we get started, I want to say something personal. Congratulations are in order for expanding the family.
Thank you so much. Excited about it.
And it's happening any day now?
July.
July. Good.
We've got some time, fortunately.
Getting it ready, getting the family ready. Congratulations. So such a good time. I wanted to ask before we get started, also before we get started, is exactly what is an interventional radiologist, and what do you do exactly at Brooklyn Hospital Center?
Sure. So an interventional radiologist, we're someone who we basically do minimally invasive image-guided procedures. So what that really means is, the old way things were done, or not the old way, but another way of doing things is surgery. So if you have cancer, things like that, you have to open up the patient's body, open up the chest, open up the abdomen, open up the skin, whatever. We actually can do things using x-rays, CAT scans, and ultrasound machines to basically put needles and wires and catheters, which are long tubes, and basically put them in to the body in various places and treat cancer, blood vessel disease, of the veins, of the arteries, life-threatening bleeding, people with blood clots in their legs or in their arteries to their lungs. We can do all of that just basically through a pinhole. So by the time it's all done, they just have a Band-Aid on wherever we entered.
How has COVID changed or remixed what you do at the hospital? Has it changed at all?
Oh, yes, very much so. So the way COVID has affected it is, so you've got the first line of people really are the emergency room physicians and all the other emergency healthcare workers who first see these patients.
Mm-hmm.
And then those patients will end up, on one of the admitted floors or at the ICU. What we're seeing right now with COVID is something that a lot of us did not expect, which is a lot of the big complications of COVID. So one of those is kidney failure.
Right.
And with kidney failure, these patients end up having to go on dialysis. And for anyone who doesn't know what dialysis is, it's basically a machine that you get hooked up to, and it filters your blood for you because the kidneys don't function anymore. So the way they get it done is to be connected to the machine, you have to put in a catheter, a tube that goes into the patient's body. So what I do is I insert that tube, that catheter, basically from their neck, and it goes down into their heart. And so this catheter gets connected to the dialysis machine. So I'm seeing lots and lots of that because these patients are ending up in kidney failure. Another thing is that even young people with COVID are developing blood clots in their legs and in the arteries leading to their lungs. So that's something that we're seeing right now. It's one of the causes of their lung disease. One of them, of course, as we know, is COVID's affecting the lungs directly. But one of them is the blood clots are actually going into those arteries in the lungs, the lung arteries, and we actually go in there and suck out the clot. And that's what we're seeing a lot of too. So it's definitely affected my practice. And I take care of a lot of cancer patients. And to be honest, I've got a number of cancer patients who have unfortunately died from COVID because they were on chemotherapy. And yeah, it's a very heart-wrenching thing because you're really thinking about what when we think of the struggles in our life and you really put it in perspective and you think about theirs, they're having to weigh up, do I get my cancer treated or do I hold off because I'm too afraid of getting COVID if I go into the hospital? And Yeah, it's really tough. So it's definitely affected how I practice medicine.
Wow, you, we've been so, I've been so focused on COVID. I haven't even thought about cancer patients and other patients that are suffering and still need to use the hospital, still need to come to the hospital. Is what do you say to those folks that still need to visit the hospital, still need cancer treatment, that are in fear of getting treated because of COVID? Do they still go, or do they hold off?
So it's a good question. It's something that a lot of people have been asking around the whole country.
Yeah.
Other interventional radio, like a lot of the forums that I'm on, whether it's on Facebook or some of the email forums, regarding how does an interventional radiologist deal with cancer patients and many other fields. How do we deal with cancer patients? Well, we do sort of weigh it up and say, how fast do we think this patient's cancer is going? Is it something that they could wait maybe 2 weeks? Or if we say, this is something that cannot wait, you really need to come in and get over here because your life expectancy without this treatment may only be a few months.
Mhm.
So if we hit it earlier, we could expand that to a year or 2 years or 3 years. So for the most part, I am bringing in my cancer patients. Jodine, I'll tell you the real issue here is a lot of them don't even want to come. I've
Yeah.
had, I've had many patients cancel their own appointments or just not pick up the phone because they're too afraid. And we end up speaking to them. They say, I'm too afraid to come into the hospital.
I
And
can't blame them.
yeah, and of course, it's not my place to tell them, yeah, come in. I can 100% guarantee you won't get COVID if you come. I can't do that.
Oh my
Yeah.
gosh. Oh my gosh. And for those who do have COVID, I've been reading, and I'm hoping you can help me navigate all this information that I'm getting. I have been reading that COVID is showing up in different ways in different people. Some folks are getting the headaches. Some people are, it's affecting your respiratory system. Some people, they don't have any symptoms, but they may just pass out and realize that there's something going on with blood clots. There's just so many ways, so many different symptoms that people are saying. What, from a doc, what should I be looking for as a 40-year-old woman? What should I be looking for in my body? How do I listen to my body at this time before I pick up the phone or go to a testing facility?
So, of course, there are the typical symptoms: the cough, the dry cough, usually body aches, fevers is a major thing. How do we define a fever? Usually, it's around 100.4 is considered like a medical grade fever worth being especially concerned about.
Right.
So those are your basics. We've had some people actually come in with other strange things: absence of smell, absence of taste,
Right.
abdominal pain, nausea, diarrhea, things like that. And that's their only manifestation of it. So, what I would say is if you feel under the weather, do what you would normally do, which is stay away from people, 6 feet. If you got to go out, wear a mask, stay home if
Mhm.
possible. If your job calls for you to be there, as things are starting to slowly open up now, that may be the case, but hopefully wherever you are is asking you to, keep social distancing, and they've got those measures in place. But those are what you're going to do for the most part on your own. The only time you really need to seek medical care is if you feel so sick that you just don't feel well enough. And that's the case for most of the illnesses prior to this. Is if you feel
Right.
sick, go to the doctor, then go. Now with the expansion of testing that's been going on in a lot of facilities, we're making that more and more available so that you would be able to get tested for it if that's one of your concerns. If your doctor's actually concerned that, hey, you may have picked this up, even though the numbers are substantially lower in New York, we need to
Right.
go down to practically nothing, ultimately, is the goal. Um,
Right.
and so you've got those symptoms, they're bad enough to come see this doctor, then hopefully they're able to test you by that point. But for the most part, people are not getting any of the heavy duty treatments that you're hearing about on the news a lot in the hospital because they're well enough to go home. That's 80% of people.
Oh, good. Oh, good. And so, talking about the numbers, I was watching Cuomo this morning. The numbers are going down, and I was excited about it. Our congratulations are in order, or we still need to wear a mask? We still need to take the safety precautions. Are we out of it? Are we flattening the curve? Is it, or we still need to be smart about our decisions?
So the curve in terms of flattening, we already saw. If you saw Governor Cuomo's talk, I
Mhm.
didn't get to catch his today, but I think the last one I saw was on Friday. And yeah, it's been going up like this, and then it flattened out, at this point already, and it's already going down, as you would have seen. So we're beyond the other side of the curve, which is fantastic.
Good.
Our congratulations in order. I would say congratulations are in order from the perspective of one, his response.
Mhm.
Another would be what we as healthcare workers are doing, and then a lot of people who should be given credit are like you, people who stayed at home and did what they were asked to do, not told to do, but really asked.
Mhm.
This was something that we were having to think more now than ever. We were having to think about the collective, right?
Right.
And how my actions affect 7 billion other people. We've never really been asked to think like that. But by everyone doing that and everyone in a coordinated effort, I think that's what's substantially gotten us to where we are today. Now, as you were asking, what does that mean from here on out? Well, I think that we can get to a place pretty soon, and I'm going to leave that up to our government, to Governor Cuomo, because he's on top of his stuff. But
Right.
when things get opened up, I would hope that's in the near future. I think we're on a different path than a lot of the other states. I think New
True.
Yorkers start getting antsy because finally we're getting the good weather, and
The sun came out
I know
today.
I know the sun's out, right? And so it's like it's beautiful out there. But the thing
Right.
is, for a New Yorker, we really really value those only few months of sun that we get, and so
Right.
we're going to get especially antsy to get out there because we're like, we got to really capitalize on this. We got 4 months, not like 8 months like everyone else.
Right.
So we're going to start looking at that and saying, well, the other states are doing it, but you have to keep in mind our our. I would put it this way. For example, my family's in Atlanta. Georgia's worst day is nothing even a fraction of what New York has. So for anyone who's watching this and they're a New Yorker, you have to put yourself in the New York mindset, or like as Nas says, New York state of mind, right? Uh,
Right. Right.
right. You have to think about where we are and what our particular challenges are. Our numbers are so much higher than everyone else's, even at their own peaks. Ours has not gotten anywhere near down to where their numbers are, where they peaked. We're still our dropping is still much higher than theirs.
But we're testing more too, though, right? Like, doesn't that account for something?
We're testing more, so that we're just simply finding out that okay, these people are negative or they're positive, but
Right.
that test only has a 70% sensitivity, meaning there's a 30% chance you were positive and it told you you're negative. So that's why I'm saying that what you really have to look for is the long-term plan is going to be social distancing from here on out. It's going from for the foreseeable future until we really have a vaccine. Until we get to
Right.
a place where, and I'm not saying no one's saying that wait till the vaccine comes out and that's when you can go back to work. No, that's a year from now, maybe more. We're just saying that in the meantime, as the numbers continue to go down and you can open up more and more jobs and get people back to work and doing what they should do, even in social settings, limit the number of people. The party that you would have had, unfortunately, some of your friends are going to be jealous because you can only have about half the people there. And I know, but when you do that, though,
Hmm.
even everyone who's there should be maintained, like no handshaking. You may not be able to hug, but that's where we are as a bridge until enough people have been infected or enough people have cleared it to have the immunity and the vaccines in place. That's going to be some time from now.
I'm a little perplexed right now because the weather is beautiful and I'm looking at these pictures and people aren't wearing masks. People are like standing next to each other and it's like scratching a chalkboard to me because we should be smart enough to be wearing masks even if the weather's beautiful. And I have family in Atlanta too. Family in Atlanta, like gatherings are happening, in Miami gatherings are happening, and folks are just not taking those safety measures. I love Cuomo's, recommendation. We've got to protect each other. It's more for other people than yourselves. But I don't know how else to suggest to people to just start with just wearing a mask. Wear a mask.
Yeah, yeah, and they've looked at that. They've looked at some of the Asian countries who have been pretty meticulous about wearing masks, being unapologetic for it, basically, and just walking around doing what they have to do.
Right.
And initially, when their social distancing guidelines and the masks were, backed, their numbers were initially low. And so I think that was a huge huge effort on our part to be able to do that. But yeah, you're right. A lot of people are just there's a lot of social gathering going on right now, and there's the masks aren't being worn. So
Oh my goodness. So we talked about what's happening. As a plant-based physician, I have to ask you about this because you're pretty much taking Western medicine and you approach it with a holistic mind, body, and soul approach. So as I'm thinking about people who are trying to, for the most part, prevent this from happening, how important is food? How important is what we're consuming in our bodies, where our spirits are, if we're meditating? How important are those other elements to us being open to this virus?
So I don't think anyone could definitively say that by eating plant-based or by meditating, it's a definitive way to protect yourself from the illness itself. What I will say is we do know from a lot of the plant-based literature and meditation literature that you substantially reduce the amount of inflammation in your body. So there are specific inflammatory markers that we actually can measure in the blood. And they've seen that people who follow a whole food plant-based diet have lower numbers of inflammatory markers. There was also some research on meditators who've done the same thing. So now, if you look at actually some of the really sick patients with COVID, they have very high inflammatory markers. And it's interesting that you asked that. There was a study that I had done. I was a part of a research team in 2009 or 2008, around that time, over a decade ago. And it was at Emory University, where I went to undergrad. And I was part of the Emory Mind Body program. And we actually did research on the effect of compassion meditation and its effect on reducing stress and inflammation. And so basically what we did is we took 60 healthy volunteers, split them into two groups of 30. 30 of them did a 6-week compassion meditation course. Another 30 did a health discussion group course. And after 6 weeks, we put them through a pretty rigorous 1-day long stress test. And I was one of the people who had to actually administer the stress test and be one of the people who kind of stresses them out, unfortunately. I know. Who would have thought?
I can't see it, but okay.
But I actually had to do that. And what we saw is that when you did a comparison between the group who did the 6 weeks course of compassion meditation and the group who did the 6-week health discussion group, there was no significant difference in their levels of inflammation. So you may say, hold on, that's not a huge difference. Then what was the effect of the meditation? That's not true. What we saw is that within the group who meditated, those who meditated, who recorded their meditations as longer and more frequent, had lower levels of this one particular inflammatory marker called IL-6. IL-6 is a well-known inflammatory marker. These people who meditated regularly and more frequently had lower levels of IL-6 in response to the stressors that we were giving them. And IL-6 is markedly elevated in the very sick COVID patients in the ICU. So you can see stress and inflammation to the body, its effect, and it's actually measurable. So my thing is, you may not be an ICU patient, but you sure as heck have IL-6 in your body. It's a natural thing that we have in terms of inflammation. So what if you at home could have less dairy, have less meat, meditate, and what are you doing to that inflammatory marker and a multitude of other ones that we measure? We just don't have them measured regularly at home because we're just living our life.
Right.
But science has shown us that those numbers do stay low. And I think that's where the onus is on us when we're staying at home to do this part, or even once everything opens back up,
right,
getting your exercise, eating a primarily whole food plant-based diet, and having a regular meditation practice. These are wonderful things for you to do.
And not to say that this is going to avoid you from getting COVID, but it definitely helps with pretty much your insides and anything trying to attack your body. It definitely helps, in my opinion. Last question. I know it's a beautiful day. I'm not going to hold you up any longer, but last question. This morning, when I was watching Cuomo, he was talking about lessons learned during his press event, and I was thinking about you during this time. You know, as I'm thinking about all the sacrifices that you and your family are going through during this time, during the pandemic. What lessons have you learned from COVID, from this pandemonium that we're experiencing right now? And anything significant stands out for you?
I would say that the greatest lesson I learned is something that I feel that we've always needed, and that's loving kindness.
Mm-hmm.
This concept of not just love as in you know, like I love you and it's sort of a superficial thing,
Mm-hmm.
but something where my actions have a direct effect on you and I care for you as I care for myself. And I think
Mm-hmm.
and I think that part of it, that can be the love part. The kindness part comes in when you're doing something with zero expectation.
Mm.
Because you can be kind to someone but not necessarily love them, and you can love someone and be terribly angry at them and not be kind to them. But I think the combination of loving kindness is the greatest lesson that I've learned that the world needs more than anything else right now, because each action and each thought that we have has an effect on someone across the Pacific Ocean, for example. And we're seeing that right now. I'm
Mm-hmm.
seeing it as a physician, and I'm seeing it with all the people I get to communicate with over long distances through things like this medium.
Right.
And I think that's the thing I feel what we can take from all of this is it's the most important currency we have. And when it's all over, we will embrace that concept ever more deeply. I hope that we embrace that ever more deeply.
Do you feel that's the silver lining and in what we're dealing with right now?
Do I feel that that's the silver lining that
Yeah,
love?
that's the love and the kindness that we're providing for each other, that we're giving to each other.
I do. If there's any silver lining I see in any of this, it is really going to be that loving kindness and the relationships we have are the greatest things that we have in our existence. They stand far above our social status, our economics, anything else that we've ever placed value over, because they are contributors to both our physical and our mental health. I think an interesting thing, we always say this phrase, right? Oh, you lost everything, but at least you have your health. Well, if that's the one thing that matters more than anything else, then shouldn't we be protecting that above all else? And I think if we operate from a place of loving kindness, we're working on our own personal health, but we're working on the health of everyone else in our community. And we're able to share that experience with each other once all this is over. And I think that's where the silver lining is.
Dr. Bahl, thank you so much. You have no idea how good it is to talk to you, how good it feels to talk to you, and how good it is to tell you right now, thank you. Thank you for all that you do. This has been a complete pleasure talking to you and learning so more. I was trying to take notes on everything you were saying because I feel like there's so much more to learn here as I continue my plant-based lifestyle. So thank you so much for all your words and your gems and your nuggets. Thank you.
My pleasure. Thank you so much for having me and wishing you continued safety and health.